things are going to get worse before they get better. And that's nationwide, but certainly applies to Oklahoma. He is projecting that 50% or more of the nation will have an increase in infections, with 100,000 or over 200,000 deaths. And that is if we continue our policies to mitigate. So as we think about these steps to mitigate the spread, he says, quote, try to get citizens to make sure they are intentionally observing CDC guidelines. And those are those items that we've listed many times. Unnecessary travel, stay 6 feet apart, and no groups larger than 10, and wash your hands before and after you touch common objects, or before and after you go in and out of buildings. If and when we see the curve flatten, or the apex and the slopes move in the right directions, we must continue to adhere to the guidance on social distancing and staying at home as much as possible, or, he said, there will be a threat of resurgence of the virus. So if we see good news, we celebrate that, but we have to be vigilant to continue forward with the same guidance that's in place. And then he mentioned these words, and I thought this was inspiring. And he reminded us, we are a strong, extraordinary nation. We will get over this, but it will require vigilance. There is a beginning, there is a peak, and there is an end. For Oklahoma, we are still in the beginning. The peak is coming, and we do not know exactly that date, but we believe the next 2 weeks in the country will be very painful. And in Oklahoma, we have the opportunity right now to make an impact on what that peak will look like in our state. So I appreciate very much what you are doing to prepare your districts, to keep your teachers and your staff safe, and also to prepare your families for the opportunity to keep learning, moving. And I know this is important to give our families an opportunity to have structure again for their students, and to be able to reconnect and engage with those teachers and those individuals that are part of their school family. This, I believe, is just as important as continuing learning. I thank you for what you've already done to make sure that people are safe, that our children are getting meals. And now as we turn our attention to how we can leverage the weeks ahead to keep learning going, we want to be very, very cognizant of the fact that this is tough, and this is not something that any of us rehearsed, prepared for, or saw coming, but it's here. And we have the right people in this state committed to doing this work, and I have confidence that we're going to get through it, but we're gonna need to do that one day at a time. When we look forward to what will the next 2 weeks look like, or the next 3, or how will we get to the finish line with graduation, sometimes that can become overwhelming. So I just want to encourage you to think one day at a time as we execute these plans, as we try to overcome some of the hurdles that we thought about and planned for, and others that were unexpected, and we'll get through those. At this time, let me go ahead and it says that the connection is not very good. So I'm not sure if that's the case for everyone on here. I apologize if it's not been something that you've been able to pick up those different announcements that were made. Is there anyone on the line that might be able to give me a message or text if you've been able to hear?
Yep, Superintendent, this is Carolyn. We can hear you.
Okay, all right, very good.
Just an individual connection.
All right, so Let's go ahead and hear some of the questions that you have, and then we will let you all get back to the important work that you're doing.
Okay, first, Jeremy, could you let me know if Jennifer was able to get connected and be able to speak regarding child nutrition issues?
I haven't seen that she's logged in just yet. I am continuously looking for her and I believe Todd.
Okay, got it. We'll move on then for a moment. Hopefully we can get her connected. Superintendent, we're still getting questions about essential employees who might be 65 or older, and should those individuals, if they're above 65, should they be designated as essential, or should they be asked to stay at home and shelter in place? And then just concerns for how that might impact the services that the district needs to continue during this time.
Right. Well, I think it's very clear. The governor has given an executive order, and that is for anyone 65 and older, or those who have a suppressed immune system. They should not be out. So that is a very easy answer. Then you need to find others who can. And this is part of making some adjustments in order to keep meals going or essential services going.
Okay, somebody mentioned that they had an employee ask for a letter that says they are essential in case they get pulled over, and asked what they're doing out and about. Superintendent, can you address that? I don't think that that's necessary.
I don't think it's necessary, but it's always a good idea to have their badge or school ID that associates them and ties them to education facility or entity, and that should be sufficient.
Okay, Superintendent, could you address if enrollment of new students is considered essential business?
Yes, actually it will be required of anyone who has a new resident that needs to enroll. So it certainly is not something we expect to see a lot of, but it is something that our school districts have a duty to allow those who move in and need to enroll. Is there anyone else on our team that wants to answer that or expound on that? All right.
I think you've answered it. I didn't know if Brad was going to chime in or not. If he's able, I think he was having a struggle with his connection possibly. So let's move on to the next question. We're having some people that are concerned about tornado season that is approaching, and whether or not they should open up their school shelters. Is there anything that we can advise at this time?
I think the answer to that is to keep our families and communities safe with the most immediate threat, which could be a tornado. But if indeed they have to come together to do that where they are still isolated and separated as family units, we don't want mixing of those tight circles, and just be cognizant to follow those social distancing rules as much as possible.
Okay, let's see here.
I think Phil has an update.
Oh, okay, great.
Oh, I'm sorry. Nope, he says there's a conversation going on in the room where he is, so it would be better if I just share this. It says the Hospital Association and Care Providers of Oklahoma said a number of districts have stepped up with tremendous help, and we appreciate that. However, the message is they still are in need of items if districts have the surplus that follow those different pieces that we shared earlier. So please make those contributions and donations as you have those and have the ability to give those to your nearest hospital or nursing home. They are expecting those. Thank you.
Okay, Superintendent, could you address the possibility of a third-year emergency certification? Actually, I think the question is regarding if they were working for 2 years at a different district and then moved to a new district for their 3rd year. And actually, that may be a question for Brad. I don't know if he, or I see Robin, maybe one of the two of them could answer.
I'll let them, just so I don't accidentally mess up things. So.
Robin or Brad, are you able to answer a question about a 3rd-year emergency certified teacher moving to a new district? Okay, we'll come back to that one. Superintendent, we had
them on, but they may not have the ability for their mic to be unmuted. Oh, by the way, Integris received 5.5 pallets of requested supplies yesterday. Their warehouse folks said to say thank you. So thank you to those of you who've contributed. Thank you very much. Let's keep it going.
Okay, we've had some requests regarding driver's education, and we've had several of those since in our previous webinars. And Superintendent, if you don't mind, I might just address some of those concerns real quick.
That sounds good.
So we are having conversations with the Department of Public Safety to discuss particularly the requirement for 6 hours of driving experience and what opportunities might be available to complete those 6 hours. So I hope that we will have some guidance for you on that in the next couple of days, but do know that we have received your questions and we are working to try to find a recommendation for you in completing hours in a safe manner, just knowing that even if those hours were to be able to be right now, it will be very difficult to actually get your driver's license since all of the testing facilities are closed or on an appointment basis. Okay, Superintendent, could you address if there is a deadline for when the assurance form and the learning plan or the distance learning plan that is associated with that, is there a deadline for submission of those?
Yes, that should have been, done before April the 6th. If Brad is able to be unmuted.
Yes, I think that's correct, Superintendent.
Actually, I think I have the ability. Brad, can you answer that?
No, I'm sorry, I didn't hear the question, Superintendent. I'm having a really bad connection here.
Okay. The question was, what is the deadline for submitting the plan for the to receive the waivers?
Okay, thank you. April 6th is the deadline, but we're taking, I believe last check a few minutes ago was at 370 that we've received so far.
Okay, thank you.
Okay, I understand that Jennifer Weber is on now, so maybe we can get her unmuted and send some questions her way. Jennifer, are you there?
I am. I was on a new laptop and it didn't work, so I got my old one out.
Awesome, thank you. Okay, could you talk a little bit more about the waiver that we got regarding the 50% rule? Specifically, we had a question on whether or not all students could receive a meal or whether it would be only those students that qualified for free and reduced price lunch.
Sure. The waiver that was approved over the weekend was for the 50% free and reduced eligibility by site. So if a school district or a site at a school district did not meet the 50% free and reduced percentage, they could not participate in SSO. Now they can. That's waived. So really any percentage of free and reduced are allowed. It has nothing to do with the student's status. Those students, regardless of free, reduced, or paid status, are more than welcome to come and get a meal anywhere they go, free of charge.
Okay, great. Thank you.
Also,
Go ahead.
I'm going to now answer that question about emergency certified from Brad, who could only hear pieces of that, but he now has heard enough to mention that The question on emergency certification question, the rule does not require that an individual be employed in the same district for the 2 years before this request.
Okay, great. That's really helpful. Okay, Jennifer, going back to you, we had a question about if there is anything that a school is allowed to do with leftover meals after the end of each day.
If they've been maintained at a proper temperature, they can save them for the next day. That's absolutely fine. If they give them away, because the intent is to prepare 1 meal per child. If they choose to give them away, those are not to be counted as reimbursable meals.
Okay, and then we had a couple of comments just with child nutrition workers who might feel uncomfortable coming to the building, and districts worried about their inability to continue to provide meals if they don't have those workers there. Would you have any advice for them, Jennifer, on how they could continue that?
I fully understand their concerns. I really do. I don't know the best solution, to be honest with you. If they can have, I don't know if they can have, or if they even want volunteers to help. I know that might be a possibility, but they might not want to take that on either. They need to use extreme caution. And I think Superintendent mentioned in a call the other day that they should probably be taking temperatures of their employees when they come to work and when they leave, so that they can keep an eye on that. But as far as where they could recruit more or get more people if they do have concerns, I don't have a good answer for that. I'm sorry, but I do know that's a concern. We had a webinar yesterday with our school programs, and that came up. And they asked, can we buy masks with our child nutrition funds? Yes, you can buy masks with your child nutrition funds. That's an allowable cost. Gloves are an allowable cost. A thermometer would be at this point, just because of the circumstances. I'm not sure. I don't have a magic wand. I wish I did, because I'd fix a lot of things right now if I could for everybody.
And is it possible for neighboring communities to help provide some of those meals? I know that if a child shows, they do not have to be enrolled in your district. Is that right?
That is correct. A child from one school district should go to another school district that they marry up to or are close to. So yes.
So that may be part of a solution. The other would be the meals to you, which would be delivery through either, is it UPS, Jennifer, that you were hearing about? The difference is, yeah, could you explain that option a little bit more?
I believe that was put in the updated FAQs, the meals to you. There's a link, and there's a website that you go to that it links to, and you apply as a district. You have to meet the 3 eligibility requirements, which are you have to be closed for 4 weeks. The one thing I do need to check on, now that I'm saying this out loud, and it just came to me, is there was a requirement that you had to meet the summer feeding eligibility requirements, which were the 50% or census. So I'm going to have to find that out. I just caught myself on something. And you have to be designated as rural, and there's a website within the website that you're going to that would designate if you are considered rural or not. And then potentially the district can opt into that for the families. The Meals to You organization through Baylor University and Texas Hunger Initiative will email you to opt in your families, and Baylor takes it from there once you've applied. So but I do need to find out about that 50%. I'm making a note right now.
And I would think that since the waiver came through for our state to not have to observe that particular waiver, that may be something that.
Right. But you're correct. That's a very, very good possibility, but all 3 things must be met. So the other thing that might not work for some is the rural designation.
Okay. And I would like to try to push the boundaries on that. So will you find out and push very hard?
Mm-hmm.
So that
absolutely.
this is available in all over the state where we have need. That would be very important.
Yes.
Okay. Okay, thank you. Other questions?
Yeah, we've had several questions about teachers that are unable to access their certification test, actually taking the certification test because the testing sites are closed. So I think I would pitch to Brad, but it looks like he's really struggling with his personal connection. So I will answer because I've been in some of those conversations, if you don't mind, Superintendent.
Sure.
We are aware of this issue, and we've had some conversations about how we can help, possibly with the ability to give a temporary certificate of some sort or an extension, allowing for an individual to go ahead and be temporarily certified if they've done everything else that was required. For example, like if it's an individual graduating from a college of education and they simply lack their certification test, we're considering some sort of temporary certificate, and we're cognizant of the other pathways as well. So just know that that's on our mind and something that we are continuing to work through. So hopefully we'll have some additional guidance for you soon, but we're aware that that is a struggle.
Thank you. Also, I saw the question saying, would you repeat who qualifies for the free lunch? That is now open to all students. And the other, I think, is a worthwhile comment, and that's that with all the restaurants closed, there may be opportunities to have new individuals that could help take the place of others who cannot work right now, but do have food handler's license and may be qualified.
Okay, we've had a couple of questions about the Federal CARES Act and about the revenue that might be coming our way, or will be rather coming our way as a result of that. Superintendent, do you want to address that or want me to address it?
I'll get it started. On our call with the White House this afternoon, they mentioned that the federal relief funds with the CARE Act are going to be distributed no later than April the 24th. And the question would be, what data will that be using in order to make those distributions among states and districts, or among states, actually. And so what they said is the latest estimates will come from the 2019 census configuration data from using 2019 and then old census data. And that there will be eligible expenditures defined in guidance, but based on what they expect that to be, it will be cost above baseline in our most recently published budgets. So they said things that look like a replacement of lost revenue will not qualify. However, we have a lot that we need to be able to accomplish and would not have anticipated in our current budgets. So I think that obviously we're looking at well over 100 million. I think, Carolyn, isn't it about 160 million?
Yes, I believe that's accurate.
And that is for Title I, or is that the total for Oklahoma?
No, that would be specifically for education. There is a little bit of that will be kept at the state level. And so I think about 145 million will go through the Title I formula from FY19. So if you know what your percentage allocation was in FY19, you can do some quick math of the 145 million and figure out what you can expect. We've been told that at earliest we'll see those funds here maybe in 2 weeks. So be thinking now about where you can use those funds, but it is going to be still a little bit before we're actually able to get those to you, and they'll of course have to come to the state and then be dispersed to districts. So probably maybe 3 weeks or so down the road at best. We'll keep our fingers crossed that everybody can move quickly on that.
Thank you. I think there still are some questions about transfers, and I think that might be referring to transfers of students. And this is something that I think there's, obviously we don't want to have more people at school than needed to perform essential functions. And yet this is something we're discussing internally. At this time, it is certainly something that if someone moves into your school, is a resident, anyone that is a resident of a district needs to be able to begin learning and become enrolled. I'm not sure if there's anyone on our team that wants to add to that. Just a reminder, regarding any fluctuation in enrollment, we have in these remaining period of time, just a reminder what the state board did. We did what we could control. Obviously, we're not able to make changes in statute. That's for the legislature, and obviously they are hampered in their ability right now to also make changes. However, we are very aware that there could be changes in enrollment as a response to the distance learning, and we are wanting to protect our districts with stability financially, as well as in the way we're calculating ADA and ADM. So that was a part of the board meeting on March 25th to have a resetting of the calendar so that those ADA and ADM calculations came based on the beginning of the school year up to March the 12th. And then it's stable at that point, and there won't be anything after that date impacting those two figures. There's some other areas that we're happy to provide that are also going to be calculated in that fashion, but those are the two main ones that I think could help alleviate some concern about how this impacts the future.
Okay, Superintendent, could you address any updates on connectivity and the possibility that federal funds might be able to be used for additional connectivity?
Okay, I apologize for getting distracted with some of the questions coming in text. So you mentioned, I think, that we are very interested in seeing the connectivity be something that is allowed and provided all across the state, particularly in our rural areas where we have historically not had access to digital opportunities for kids. And this is something that I intend to see the ability to connect homes and get devices and access to children as a high priority with some of the funds that we see coming in with the CARE Act. And I believe there's support for that, but this is something that only highlights the inequity that has existed all this time for rural Oklahoma and other areas of the state where connectivity, whether it's devices or through carriers, has not been accessible. So we will work very hard through the work that you've all provided with the surveys to have a county by county view of what is needed, what devices would be needed if we were to go to a true virtual platform, if a district so desired to do that in the future. We want this kind of connectivity with or without a great need like we find ourselves with a global pandemic. But this is something that should be taken care of, and we're committed to seeing that happen for all of Oklahoma families.
Okay, Superintendent, I think just a few more questions. I think we've answered most everything so far that's come in. Jennifer, if you are available to answer one more question, we have a question about, is it allowable to give a one-time stipend for a child nutrition worker who's coming in daily to provide meals while other support staff are not able to work and are still receiving their full salary and benefits?
There is, that's a tricky question with using CN funds with for stipends, bonuses, and such. Can I look into that a little bit more? There, you have to be very, I don't want to say sneaky, but you have to do it a certain way. You can't call it a certain thing to be able to do it, but there is a way to do it. So let me get that information. I believe, I don't want to say this wrong, I think you can call it a stipend, but you can't call it a bonus, but I want to make sure we give you the correct information.
Okay, that's helpful. And then Superintendent, maybe last question here for you, and then we can wrap up. Is there anything additional that you would want to say about the support staff issue and folks that are not able to work during this time for either they're in the high risk category or don't have appropriate work to do while buildings are closed?
Yeah. So we are committed to finding a solution. We know that the legislature wanted to be able to help us in that way. We have crafted language that we believe could be provide some kind of authority and ability to answer this within the next coming weeks. And so I just want you to know that it is still high on our priority list, and we believe we are getting close to a solution. And I would just say, please hang on. And I think we'll have some good news very soon. In fact, we hope to have an answer by the end of the week. So just please hang on with that. Most importantly, we want our support staff to be safe. And we know there are those who are very concerned about the risk they take coming out to a school building, interacting with others in a kitchen, and especially for those who meet those criteria of high risk. So first of all, those who are at high risk because of their age over 65 or a compromised immune system, they should not be asked to be there. And the pay should continue for them. And then I would say to the rest of you, I want to ask if you can relate to this. And it's a email or a text message that I got just recently, and it just really struck me when I read it, and I felt that it just so eloquently put the kind of stress that is on so many of you right now. So I got this message and it said, Superintendent Hoffmeister, it is becoming more and more challenging to maintain the morale of our support staff who are feeding our students. They are worried about their health and the health of their families. Frankly, so am I. We have parents who have made it known that they do not want educational materials delivered or sent to their homes. I have certified staff who have commented that they have concerns about handling this material when it is returned, and I don't blame them. Positive cases in our state are increasing exponentially. I'm not sure how long we can hold on or hold our current position on track. It becomes more challenging each day. I'm not sure we can make it to Monday. And May 8th sounds like an eternity away. So I know that superintendent speaks for hundreds of you. And I've seen other texts that have come through where superintendents have said that they are working harder than they have ever worked before in their career. That it's mentally exhausting. It's physically exhausting. They aren't sleeping, they're worrying, and they are carrying on their shoulders the worries of their community. And so just hearing that, I want you to know that we have to look at this one day at a time, and we are making plans now. We're preparing now, which is the way to do it, not amid a crisis. We know that it is going to get worse. And I would just ask that you extend grace. Extend grace to those around you, those colleagues. Take care of yourself as much as that is even possible. But also know that we are together going to get through this. And I would always keep in mind that our priority is the safety of children and their families, your staff, and the community. And second to that would be learning. But those plans that you are making are important because they will re-engage children with their teacher, with their school family, and that's just as important in many cases for our students who are in even risky home environments, to have that connection with their teacher, a call, a well check. Those who might not have been their teacher but have a relationship with them, know them from the playground or from an elective class even in the past years. Those connections are critical. And if that is what it takes, and some of what our plans have been don't materialize the way we expect, it's okay. We will do the work we plan to do the best we can, and we are wanting to share that burden right there with you. So I just want you to know I admire your leadership, and I admire all that you are doing to support those in your community during an uncertain time. And we will, again, take it one day at a time, and we will get through this. So I appreciate each and every one of you. Thank you so much for joining this call. We've got other opportunities to talk more deeply with our various webinars that we've shared that are topical and deal with certain content area. So I invite you to join those. And then I would also say, you know, give me a shout, give me a text. We'll try to get good minds together on any unexpected hurdles, and we're going to get through it, and we're going to keep our communities safe in the process. And most importantly, I believe we will strengthen those relationships and those ties that bind Oklahomans together. Take care, be safe, and I'll talk with you soon. Bye-bye.